The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar today will discuss the impact of complementary therapies on quality of life for brain tumor patients. My name is Jillian Demas, Senior Program Manager here at the American Brain Tumor Association, and I'm delighted to introduce our speaker today, Dr. Mary Hardy. Dr. Hardy is a board-certified internist who has been including complementary and alternative medicine in her integrative medicine practice for the last 30 years. She is a member of the board of the Society of Integrative Medicine, and in this webinar, she will discuss the safest way to use effective dietary supplements and other complementary therapies during the care of brain tumors. Thank you so much for joining us, Dr. Hardy. You may now begin the presentation.
Thank you very much for having me, and I'm really grateful for this opportunity to speak with all of you today. You see my slides here, and I'm going to go through them. I will, at the end, answer questions. So let's begin with the position that, I'd like to start with some humor. So let's begin with the idea that the patient sitting in the operating in the examining room, and in comes the doctor, and the patient says, "Truth is, doctor, I've lost faith in Western medicine." This is, I think, a misconception. This is how I think many physicians feel that patients who want to use complementary and alternative therapies have turned away completely from Western medicine, and in fact, it's anything but the case. For many patients, they want to get this information in the context of their medical care and ideally be able to discuss that with their treating medical team, physicians, nurses, etc. So before we start, I'd just like to take a moment and orient you to my talk. This talk is really going to be relevant for all brain tumor patients because many of the symptoms of brain tumors occur because of pressure in the cranium, and so they have similar causes and will have similar ameliorating strategies. But when I speak with you and with physicians and when I take care of patients myself, I think scientific evidence is very, very important. It shows us what could work. It shows us how to use the strategy that we want to use, and it's especially important for safety. Now, it also helps you when you're trying to talk to your healthcare team about what you would like to use to be able to say there is some evidence. So the way I'm going to talk to you today is going to be not completely, but largely by showing you medical studies, just like I would teach my medical students or share with other physicians. But this is going to make a limitation that may be difficult for some of you because most of the actual studies that have been done on malignant brain tumor patients. So those of you with non-malignant meningiomas, cranial-pontine angle tumors, or other types of tumors that I don't appear to be addressing directly, please know that I have those in mind and that I'm just showing you what the literature has, but we'll extrapolate from that to other concerns. So a lot of people in the course of treatment for cancer are using, and general health care, serious medical illnesses, are using complementary and alternative therapies, and this use can exceed 80%. The variety of therapies that is used is very wide, and significant amounts of time and money could be spent procuring and utilizing these therapies. Things that predict higher use are being younger, female, having a higher education, and in conditions which have a generally more difficult or poorer prognosis, then there's often higher utilization. Now, for primary brain tumor patients, some of these caveats apply and some don't. So a little over a third of patients were using some kind of complementary alternative therapy, which I'm going to refer to as CAM in general in this website. And so 2/3 weren't. But the third that was using, most of those patients were using more than one kind of treatment. Most people didn't find out about these therapies from their medical team, and the vast majority didn't disclose to their physician that they were using anything other than the conventional treatments that had been prescribed to them. Most people hear from their families, friends, or from the internet And so we're going to spend a little time in a moment looking at how the Internet is a useful thing, but where there might be some problems with what you find on the Internet. Cost is usually pretty modest, but cost can also escalate quickly to significant sums of money. However, patients who did use these therapies had a higher performance status. They were able to do their activities of daily living. They were eating, sleeping, walking around, etc. But that didn't turn into really formal measurements of quality of life. That's what QOL means. So people who did this were committed, found some benefit, but probably not all the benefit that they necessarily wanted. This shows you, and again in patients with glioma, this is just a report of what this group of patients were using. And you can see the area is very broad. And you can see, for example, things that are pretty commonplace that we hear a lot about: acupuncture. We're going to talk about special diets. We're going to talk about boswellia or boswellic acids, some vitamins, and some herbs. So we're going to get to a number of the areas that are commonly reported to be used. When patients were asked to explain to us how and why and what you were using these things for, and again, this is for glioblastoma multiforme patients, but I think I've heard these same kinds of statements from a wide range of patients. One of the most important ones is, I want to do something for the treatment by myself. As you get a serious medical diagnosis, you get launched onto I like to call it a roller coaster ride, where you're not the driver anymore, and that can be just overwhelming. So having therapies that you can empower and you can do for yourself that you're clear will make a difference can be go a very big way to giving you back some sense of control and some actual control, and that is real helpful in decreasing anxiety. Now, in addition, patients who are being asked to take a chemotherapy target using these materials to decrease chemotherapy. Stress management is a huge issue during a difficult medical diagnosis and time. And some of these are more negative, like being afraid of conventional medicine. But by and large, the majority of people really want to try to help themselves, relieve some stress, take care of some side effects, and support the conventional therapy. So that's the manner in which we're going to talk about these ourselves. Again, just stress this issue about reporting what you're doing to your physician. Like you saw in the previous study, that close to 75% of people were not disclosing what they were using. I think that's a problem, because non-disclosure, if you don't tell your team what you're doing, there are real consequences that can happen. They may not know about an herb that you're using, let's say, and there could be a potential interaction with medication they're giving you, or some things may predispose you to bleeding, and that could be a very serious complication for virtually any brain tumor patient. So the consequences for non-disclosure can be marked, but it's not a stress-free event for a lot of patients to disclose use to their providers. I think patients are very afraid of what their physicians and nurses will say. Many people expect and often, unfortunately, receive a very negative response. Don't do that. It's all quack. Why would you want to do that? And that can be just devastating for a patient who's so dependent on this physician to treat them in this critical time. So patients are going to go a long way to avoid an excess negative interaction. However, also, and this one's on us as the physicians, many patients don't think we really have the expertise to adequately comment on products, what products, how to use them, and how to use them safely. So I strongly encourage you to talk to your doctor, your nurse, the rest of your medical team about your complementary alternative medicine use, and to facilitate that discussion so that it's as specific and useful as possible. I'm going to recommend that you bring whatever material you're using to help you make your decision. So for example, if you're on the internet and you're reading sites or you have a book, bring that material with you so you can show your medical team exactly how you're making this decision. And if it's your Aunt Susie, who's your medical advisor, your lay medical advisor, I like to say, if Aunt Susie can come with you to the appointment, it's incredibly useful, because then the person who's advising you at home and the medical person who's advising you in the clinic, everybody can be together so that you can get a really coordinated plan going. And if you are taking supplements, please bring the actual bottles. Also, during the time of treatment, don't brand shop. Don't switch from brand to brand to brand unless you're told to pick a particular brand by your medical practitioner, because you want as much consistency so that you can have predictability about the effects of the material you're using. Now, let's talk about how do you find valuable information. We said before, friends and family are the most common source, and the Internet is increasing in importance. It's why we're all talking today. And these are good sources. They can be repositories of terrific information. But remember, your friends and family may not know everything about your medical condition, so they may not be able to comment exactly right, have exactly the right advice for you. And in the Internet, this may come as a shock to many people, but not everybody is well-intentioned. So caveat emptor, buyer beware. You want to come to this experience with a little bit of skepticism so that you're not surprised by finding negative or having adverse effects, or finding out information that's just going to make you have more risk or have an ineffective supplement. Often I'll find that if I send my patients to a health food store to pick up a particular supplement, the clerk there will be very happy to weigh in. Now, I don't mean to be derogatory to any particular group, but that person really doesn't have a medical background. And whatever advice you get there, definitely funnel it back through your medical system for a pharmacist, a nurse, a physician. Now, and even your CAM provider, let's say you're getting acupuncture, or you're getting a particular kind of massage, or whatever other particular thing that you're doing. Some complementary alternative medical providers have become very savvy and very fluid at being able to work in the conventional system. For example, I know acupuncturists who are very, very, very used to working with cancer patients, so they are very aware of the medicines that are commonly used, where they should stay away, how they should modify their therapy to give a good support without increasing risk. And that person can be a very useful provider to help you think through what you're going to use. Now, I would say if you could connect a savvy CAM provider with a healthcare provider, doctor, etc., that's an ideal team for you. And you should pick and choose and identify whoever you need to get the right information to maximize your treatment. And this just reinforces the same message that friends, families are very, very important information sources. And in this particular study, I was really happy to see that physicians were starting to be identified as a significant source of information. But again, here's the complementary practitioner, and honestly, I think this is an underestimate for the Internet, because that's just a huge source. Self-help groups are another place, but I count those largely like family and friends. Okay, so this is just looking at when brain cancer patients went onto the Internet, what did they find, and what did they contact when they got out there? So people tended to hop on the Internet if the tumor was a higher grade, or if the symptoms were worse, or if the diagnosis was more guarded, the prognosis was more guarded. It could take, some people would spend 4 hours a week, some people spend more time than that. It generally seems that people spend a lot of time at the beginning and then start to taper off on their time. And this, again, is on us as doctors. Many people hopped on the Internet because they weren't getting the information they felt like they needed from their physician. And people will go on the Internet to look up conventional medical information or to look up alternative medical information, but also they want to get emotional support. And it was really I think, an eye-opener for me to realize that about 50% of the time spent online was looking at self-help activities or engaging in a group support kind of experience. So I think you can get a lot out of the Internet. There's a lot of different kinds of information. But if you're not getting information you feel like you need for your medical team, by all means go back and make sure you get that information from that source as well, because you should be. I just put this site up because I think that this is one idea of how you can think about credibility. So this was honestly a site that I accessed I think a couple of years ago, and this looks like it's a really significant medical type site. It looks really serious. And then here's this new brain cancer treatment free of side effects. And that's not uncommon when you'll see these kinds of sites, and it looks pretty official. But this site turned out not to be independent information. I think as I remember, it turned out to get you into selling you a supplement. So these kinds of biases can be very hard to find sometimes. So be a little smart owl. Keep your keep your other hat on so that you feel like you're still hearing from others, but don't just jump at everything that looks too good to be true. When you're deciding on any new therapy, this is the process. You're going to balance the risk of that new therapy, and you could think about the risk of using it or the risk of not using it, but let's talk about the risk of using it now versus the benefit of that new therapy, and then you balance that all off against cost. And I think you're going to find that if you do this correctly, the risk is going to be very low, really manageable. The benefits are clear, and then the cost is reasonable. If the cost is not reasonable, I really rethink this whole thing. That's a real red flag for me. So I'm going to share with you my red flags for CAM therapies that are too good to be true. This means, where do I start to get really suspicious and worried and stressed and thinking about how something could be harmful or not useful, or where do my suspicions really come up? Well, if you can have a treatment that's good enough to cure cancer and is that strong but has no side effects. If it's too good to be true, it probably is. Over-promising. There was a complementary provider who first wrote the Cure for AIDS book, and then she wrote the Cure for Cancer book, and then her final book was the Cure for All Disease. That's a classic case of over-promising. If you can't see what the ingredients or the formula is, if something's secret, if I try to talk to a practitioner and they won't disclose, at least even in a general way, what's in their formulas, that's a very bad sign. If something's expensive, if the person won't talk to me, if they can never tell me, if they say this is clinically proven or they have research, but they only ever tell me a story. An anecdotal evidence to a doctor is a good story to you. You heard about someone who did really well. That's really compelling, but when you only think about this kind of evidence, you don't remember the other patients who didn't do well. And I think you need to hear about both kinds of patients. It doesn't mean that you wouldn't try something, because even if only 15 or 20% of patients did really well, if it's not harmful, that could still be a reasonable choice to make. But I find out what people do is tell you all the good stories, so they're over-promising. So if you see these red flags, then you should be very suspicious, cautious, and proceed really with your guard up. Now, as I said earlier, if things are prepared properly and used appropriately, these materials are usually very safe. You should disclose. Again, I'm just hammering that point home. And how do you find a good provider? You want to go to an acupuncturist. You want to go to a massage therapist. You might take a recommendation from someone who's very knowledgeable. Ideally, your medical team, your doctor, nurse, PA, nurse practitioner, etc., has worked with someone that they work well together with. That's a great way to find a practitioner, because you'll know the communication will be good between the team. Even if it's a provider you find yourself, They should be willing to talk to the medical team. People who can be licensed should be licensed, and their license should be without any blemishes or problem with it. They should work well with you, answer your questions, and ideally in the language you both speak. A lot of my patients would go to Asian practitioners of Chinese medicine, and the person, the practitioner either spoke, not much English or not good English, or there was a translator that wasn't really up to the task of translating. So you can still get good treatment without being able to talk especially well to the provider, but I think that really puts you at a disadvantage. Now, here we're going to start talking about what kind of therapies are available, and you can see it's everything from diet, meditation, herbs, supplements, exercise, etc. And how do you choose is a real problem. We'll talk about a lot of stuff today, and these are all parts of a personal wellness plan, but this plan should be individualized for each person, and it should be done in conjunction with the medical team. So these are going to be things for you to think about or go talk to your treating practitioners about. So here's what I think are really good goals for integrative CAM therapy in oncology and other serious medical illnesses. So you should aim to improve your general well-being. That's always a great goal. If you're eating well, sleeping well, moving around well, your mood is good, you're just going to be well. You're just going to generally be a lot better. You want to increase your energy and decrease pain. You want to take care of some of the side effects of conventional treatment. These three, I think, are definitely within your purview to do. Now, where we can, we like to think about increasing the effectiveness of conventional care. We always want to decrease emotional pain. And again, these therapies work in two ways. They directly affect these kinds of emotional events, and then they also, again, involve you in your own care so you don't feel so out of control, and that will decrease anxiety. There'll be a lot of lifestyle issues to use following treatment, and so these things we think should be considered helpful for helping you to be well and stay well after treatment is complete. You want to act these things can also act as safe and effective chemotherapy agents, and always, 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 even if treatment is not directed for complete healing, for complete cure, healing, soothing, doing much as well and even better than expected is always possible. So the components of the wellness plan. The first thing we want to look at are diet, exercise, and stress management. And those are, I think, three basics that come in virtually any treatment plan. Then we look towards supplements, complementary therapies. Maybe we'll make recommendations for changing the medicine back to the conventional medicine team. And also, I think the issue of spirituality, meaning, whether that's through a conventional religion or through a more spiritual, not religious pathway, is always very helpful. So I look at evidence. It informs my decision, but it isn't always available. So I do the best I can, but I don't go back and look at something in a cell culture and jump right away to giving that to a patient. So I think you can always think about making yourself, those of you who are worried about cancer, cancer-unfriendly. These brings up issues and discussions for patients that are so challenging. But you want to be able to decrease inflammation as a final common pathway for a lot of symptomatology and the progression of a lot of chronic diseases, including cancer and abnormal cell growth. So to do that, you want to maintain your weight. You don't want to go too low, and you don't want to go too high. You want to eat foods that decrease inflammation, foods like plant-based proteins, lots of fiber, not simple sugars. If, in fact, you have another disease like diabetes that promotes inflammation, you want to get your diabetes under really good control. It's going to be challenging if you're also taking a lot of steroids, but having that other medical process control is going to make using anything else better. And then you can choose supplements that decrease inflammation, and we'll talk about more of those as we go forward. So again, don't eat saturated fats. These are animal fats and fats that are generally solid at room temperature. Just going into the diet a little bit more detail. This is also decreased animal protein, especially beef or red meats or processed meats like salami, bologna, things that have been smoked. When we say eat a low glycemic index food, this means foods that don't have a lot of simple sugars. Simple sugars are high glycemic, which means they dump a lot of sugar. Glycemic means sugar. They dump a lot of sugar into your bloodstream, and as they dump sugar into your bloodstream, your insulin goes up, and that increase in insulin causes increase in inflammation. So cold water fish is salmon and things like that, very important. We also want you to eat more fruits and vegetables. Now, supplements, things like fish oil and certain herbs that are listed here are also very useful for helping to control inflammation. In the future, the doctor is going to be showing a diet to the patient, get them to eat their medicine. As Hippocrates said, let your food be medicine, let your medicine be food. So less animal meats, more complex grains, better fats, herbs and spices, and a lot of fruits and vegetables. You can see your plate is mostly full of fruits and vegetables here. For brain tumors in particular, there are a lot of nutritional challenges. Protein breakdown is really marked, and it can follow, and catabolism means breakdown, it can follow elective brain surgery. So when you have that really stressful time for your body of surgery, your body starts to pull from other resources to support the functioning of the body and to repair the injury made by surgery. So you're going to then break down muscle. And if you break down muscle to help repair your surgery, you're going to feel weaker and less altogether well. So you're going to use up a lot of protein, you're going to use up a lot of albumin and other resources. And you may also have nausea related to either your primary tumor or to your symptoms of surgery or swelling. Medications can really interfere with appetite, and taste changes can accompany either the primary event or sometimes the treatment of that event. So as you're thinking about your nutrition, you're going to want to make sure that you have more protein than you normally eat, and that it's good quality protein and it digests easily and well. You're going to want to break your meals up into small, frequent doses as a way to help with nausea. Extra protein helps with nausea. Ginger helps with nausea. And then you're going to want to take medications that interfere with appetite away from the time you normally eat. You probably will find it easiest to eat first thing in the morning, and then you're going to want to also be really careful to test your taste palate and make adjustments in your food so that things taste more normal to you. So there are a lot of misconceptions about what makes healthy food, and so don't be the person thinking that just because you put the doctor and the nurse in the pot, you're going to have health food. So one of the big things I hear about all the time, eat antioxidants during my treatment. Will they help me or will they harm me? And I think this is really a very, very, very important topic to talk about. Antioxidants are some kind of a chemical in the body that counteracts the damaging effects of oxidation. So you see oxidation every day when something rusts, turns a different color, like a metal turns, tarnishes, that's oxidation. So if you have taken antioxidant, it reverses that breakdown that you see with oxidation. So we generally think of antioxidants as protective. During the time of treatment, often when you're using radiation or chemotherapy or things like that that work by increasing the oxidation in the tumor, you'll be asked to avoid things that would maybe protect the tumor. However, I don't think antioxidants in foods are going to be harmful at all, and the research doesn't show that. And you'll know a food is high in antioxidants if you get brightly colored fruits and vegetables. Spices generally are high in antioxidants, because spices were first used not just for taste but to preserve food, so that's an antioxidant effect. And then beverages like tea, especially green tea. Now, if we look at the studies, if we have a food that's rich in antioxidants, it tends to be better for preventing the recurrence or the first event of cancer. So I'm going to show I'm not going to show you this slide in general. This is what a table would look like from a research article. And the whole basic point of this slide is that if you have high antioxidant and you take some supplements and vitamins, that the risk for these patients, in glioblastoma patients, it tended to improve their survival. So again, if you actually look at the literature, not what people are worried about, antioxidants in food are actually helpful and protective. One diet that's been used with some success in brain tumor patients and in seizure patients, actually, it was first developed for seizure patients, is what we call the ketogenic diet. And this is taking advantage of something that occurs naturally when you're not eating quite enough calories and your body starts to break down fat. It's going to release these sort of little pieces of fat called ketones into the bloodstream. And normally the brain doesn't metabolize these very well. But cancer cells can't metabolize it at all. So, and damaged cells can't metabolize it at all. So the idea is if we put the body into the state of making ketones by dropping what you're eating and making sure you have virtually no carbohydrate, very, very low carbohydrate, and eating more fats, then you're going to get your body into this metabolic state where the normal brain cell will be forced to use ketones, but the abnormal cells won't be able to use them. It's been real successful in animal models. It's a little tricky to do. In fact, it's pretty tricky to do. So it should not be done without supervision from your physician and nurses and hospital team. And it really is probably too difficult to do with diabetic patients. And it should not be done in patients who've lost a lot of weight. That's what cachectic means. Now, let me show you on a little picture. So here's a time and this is days along here. This is how much sugar's in the blood, and this is how many of those ketones are in the blood down the other side. And you remember back at the beginning I told you we didn't want you to be eating a lot of simple sugars because it dumped a lot of sugar in the blood. There's two parts to this. One, that sugar is very easily goes to the tumor. It's easy for the tumor or the abnormal cells to use it, and we don't like that. And also it dumps out a lot of insulin. So as you change what you eat, okay, so down here, no change in diet, no ketones. The diet starts here, and then as you push down the number of carbohydrates you eat, and you're pushing down the amount of sugar you put in your blood, and you're restricting your calories a little bit but not a ton, then you see the ketones start to rise. And there's a particular sweet spot where you push things down just enough to get a good amount of ketones, and here is where in animal models and some human models, growth has slowed down. Now, you do not want to go into starvation mode, and you don't want to lose a lot of weight. So that's why I said this is a little tricky. Not everybody can do it, but some patients have had results with this, and I would discuss the option if you want to try this with your physician, because this cannot, should not, do not do this without the active participation of your medical team. So now we come to what some of the more aggressive treatments that we often use, and so this is a physician talking to his patient. Yep, we found a mass, but we have weapons of mass destruction. And I think that description of mass destruction describes the patient's feeling, because my patients are always and rightfully fearful of what's going to happen when they take these strong, potentially toxic therapies. So these are the symptoms that you might see, again, either as a result of your treatment or from the original tumor itself. So we're going to talk about some of these actual symptoms in more detail now. So we know that if your quality is better, you're going to survive your brain tumor longer. This seems pretty straightforward, but it's been shown pretty clearly that if you don't have fatigue, you live longer and do better. If you do have fatigue, you're on the lower curve. And I think if you're not fatigued, you're able to maintain more normal activities for a longer period of time. Also, if you were depressed, and I mean physically depressed, not down and upset because this is tough news, but the real medical illness depression, that your survival time was cut either by 2/3 or 1/3. So if you have those medical complications, it needs to be addressed. If you're not able to get around and feel like you have a good quality of life, that needs to be addressed. And both of those will help your survival. This is a kind of thing looking at patients. Now they're looking at physical complications. So when people were physically depressed, they got more deep vein clots, more infections, more adverse drug reactions, and their seizures were harder to control. So if someone asks you, are you feeling depressed, it's not a judgment about are you strong enough to cope with this. It's really if you have the physical, the wrong neurotransmitters in your brain, the physical disease of depression, you're going to impair your ability to fight and to do well and live longer. So by all means, don't take offense at that question, but get the proper medication if needed. Same kind of thing. Depressed, not depressed. Longer survival if not depressed. So one way that you can participate in your management of mood and stress and depression is to practice stress management. This is really important of any treatment program. It will help with your symptoms. It can improve your quality of life. And there are a bajillion ways you can do this. You can do yoga. And this is a stretching, breathing, relaxation practice. Be sure you go to someone who knows how to adjust the poses you're going to get into. So, for example, you shouldn't do any poses with pressure in the brain where you turn your head upside down. So, if any of you know about yoga, I don't have brain tumor patients do downward-facing dog. They'll adapt the pose and do something different. Virtually any form of meditation, visualization, making pictures of the tumor melting away in your mind, doing a particular technique called mindfulness-based stress reduction, anything like this. For many people, prayer is a form of meditation. Besides just its religious benefit, getting into that prayerful, quiet state is very healing for your body. You can keep a journal. You can write in a journal. You can make pictures. You can participate consciously in activities that are joyful. I've had so many patients say to me, you know, I love my kids, I love my dog, but I'm going to stay away from my grandchildren because I don't want to get sick. Well, let's find a way to make sure that you see as much of your grandchildren as possible, because that makes you feel better and be better, and your mind-body system works better. I do a practice myself where I write down 3 things every day that I'm grateful for and why I think they happen. And there's strong literature to show that this readjusting of my attitude will help with anxiety, depression, and it helps me rededicate myself to why I do the work I do. And something as simple as getting out in nature. If you can't walk, get in a wheelchair. Not only is it going to bump up your vitamin D, but it really is one of the most healing strategies that you can do. And make sure the things that give you joy you do every day. Even massage has been shown. So the blue dots are people who got massage, and you can see their stress scores going down as they get their massages every week as it goes along. And so they've come way below the stress threshold. But what's interesting about some of these techniques, like massage, is it works while you're doing it, but notice here that the week that they stopped doing massage, the stress came back up again. Doesn't mean don't do massage, and I think a great thing would be to teach a family member to do a hand and foot massage, very comforting. But that's a kind of a technique that needs to be applied consistently. The meditation practice is like learning to ride a bicycle. It's a physical skill. You have to practice it. Even walking outside can be a really good stress reliever. Many of you are going to want to use traditional medicine, acupuncture, and herbs. Again, find a practitioner who's had experience treating cancer patients. Talk to your friends, talk to your doctors, talk to the pharmacy. Things that acupuncture is particularly good for are nausea, pain, anxiety, fatigue, and dry mouth. There are very few contraindications, reasons why you shouldn't do acupuncture, and most of them can be worked around. Chinese herbal medicine, these are pretty strong interventions. You shouldn't take those without the medical team talking with the Chinese practitioner. Don't stop if your first treatment didn't work right away. You can sometimes have to go for 4 weeks to see a full response to treatment. Now, there's been a couple of studies, sorry about that. There's been a couple of studies looking at nausea after surgery for patients, and these patients got relatively simple acupuncture. It's the P6 point is right where your watch bands hit your arm on your palm side of your arm. So you could get this acupuncture with a needle, and you could also end up doing it with acupressure. And the results were really good. Patients had both above the tentorium, above the membrane that divides the brain, and below the tentorium. So a cerebellar tumor as well as a frontal tumor. So and both groups of those kinds of patients saw benefit. A second study that got a very similar benefit with acupuncture for radiation. I know many of you have gone through this. The patients who were nauseated had less general well-being, more anxiety, and more depressed mood. So again, sometimes treating one symptom can really push out a lot more benefit. So there's a lot of supplements that could be used, and I'm going to mark a few that I have put here in yellow we're going to talk about. So to start with, carnitine, which is an amino acid, very useful for radiation-induced fatigue. That means that sometimes you feel tired during radiation directly as a side effect of the radiation. So they had a small number of patients. They had about 18 patients, but most of them were deficient in this amino acid before they started treatment. So they gave people carnitine, and they got their carnitine to come up, and it helped their fatigue. And carnitine gets burned in the energy system that helps produce energy for the body. That's how that works. Now, I know a lot of you have edema. And you have edema either because of the tumor itself or because of steroids being used to try to protect, and therefore you're either because of the original tumor or because of some treatment, because obviously after radiation there can be some swelling that occurs as cells die. And you're often given corticosteroids to sort of help limit that swelling. But you know there's a bunch of side effects from cortisone steroids, which I've listed here. So in order to try to help with edema and therefore not have to use so many corticosteroids, we look at the use of an herb called Boswellia serrata. This is the plant name, the scientific name for frankincense, which all of you know if you've ever been to a church where they use incense, that's almost always frankincense. So this is, again, a small study with a small number of patients. They took a couple of different kinds of patients. Most had edema, and they gave them a particular extract of Boswellia at a fairly high dose. So that's 1,200 milligrams 3 times a day. But I don't really think patients need to use that much to start, and I don't usually start there. But edema was reduced in a significant component of both groups, and it allowed steroid discontinuation in 3 out of 5 patients in the second group. So it looked like it was very helpful in stopping the edema related to treatment, and it was easy to take and didn't cause any upset stomachs. This is another study, a little bit bigger study. They took, again, patients with brain tumors or brain metastases, and they were going to do either partial or whole brain radiation up to about 60% of the brain volume, so pretty significant. 44 patients went into 2 different arms. Again, the dose that was used was around 1,200 to 1,400 milligrams 3 times a day. And at the end of radiation, the patients who had gotten a tumor response had decreased radiation. And in this group, they didn't take away any of their other medications, but there was no increase in adverse events, which is good. And there was a little bit of patients. One patient had some diarrhea, but nothing that was significant enough to stop treatment. So again, evidence for benefit for using this Boswellia serrata or frankincense. Now, if you're going to use an herb, it's very important that you get an herb that's exactly or very similar to the one tested in the study. So as you talk to your healthcare provider, you want to ask for recommendations for what brands and things like that are quite good. Now, and again, ginkgo has also been shown to be helpful with brain radiation. So I can see that we're coming close to the end of our time. So I'm going to skip some of these direct slides now, and they'll be there for you guys to see, and they'll be easy to read. I wanted to have time to talk about the caretakers, but they unfortunately always get the last thought. If you've enjoyed the way I talk about this, things that you can always come onto my website, and it's drmaryhardy.com. I answer questions there as well, and we'll we'll write about things to keep you up on the newest literature. So I am going to stop now so that we can answer some questions. Sorry for being a little long on that.
Yeah. Thank you so much for doing this for us. We really appreciate it. I'm going to read some questions to you. If you have a question you'd like to ask, type it in and submit it using the question box in the webinar control panel on the right hand of the screen. So let me go with some that were submitted beforehand. Let's see. One person is interested in the role of therapies such as HeartMath, massage, and Reiki.
Yep. Okay. So HeartMath is a style of training, biofeedback training, and it teaches you, and usually it uses, you put sensors on your finger, sometimes on your ear, and you watch your heart rate. Now, if you're stressed out, your heart rate is high and it doesn't vary. But by doing these meditation games on the computer that HeartMath uses, as you get more relaxed, your heart rate starts to vary more, and so you are given feedback while you're looking at it. That's another nice, very nice style for meditation. And for people who are younger and maybe play video games, that's a particularly nice interface. Or if you're a very concrete person and you like to see your results in front of you, a good technique. Reiki is a kind of healing touch where sometimes you don't really touch the body. It's an energetic treatment. People can be certified and trained for that. And one of the major benefits of that kind of therapy is many, many patients find it to be deeply relaxing. It's also a nice treatment to give, so it's a nice thing because the person who's giving the treatment gets into a deeply relaxed state, and so does the person who's receiving the treatment, and I like that about that. So it was Reiki, HeartMath, and what was the third one? So
Thank you.
Okay.
Okay, sorry. I didn't know if you were done yet. Someone's asking a question about the paleo diet.
Okay, so the paleo diet is that's basically a low-carb, high-protein, and hopefully if you do it right, it's a lot of veggie diet. You can arrive at and the problem with that diet that I find that's a little hard in this situation is you eat a lot of meat, and that people generally get their protein from meat in that diet because they're really avoiding carbs. And you'd have to be a little careful that things weren't too fatty, too hard to digest. I would include a lot of fish as opposed to only meat. And so I think there's a lot of, you could use that diet but as one of the ketogenic type of diets. So, but just be careful, good nutrition, check with a nutritionist.
What dose of vitamin D did you recommend?
Okay, so vitamin D is one of my favorite things to talk about, and I had it in the slides. You all can read about it. But I think vitamin D is a very important ingredient in our body, and it does a bunch of things. It helps with immune system support. It helps fight off infections. It helps tumors to become less abnormal and more normal. So I think you want to know your vitamin D level. You need to ask your doctor to draw your vitamin D level because there's no magic number. But I would say if you don't have the ability to get your blood number and follow it, I would say at least 2,000 international units. If you get your number and you know, if you're under 20, you're considered deficient. Many people who have tumors in general are deficient in vitamin D. In fact, most of us are deficient in vitamin D. So if you know your number was 20, we want to get you to around 50, then you would work with your clinician to get either a prescription for vitamin D or take an over-the-counter vitamin D, and that your dose would vary because everybody needs a different amount to get to 50. So if you don't know your blood number, take 2,000 international units, and if you do, take enough to get your level up to 50 nanograms per ml.
Good Lord. There's two questions regarding the immune system. One is asking about Celebrex, and the other one is asking about Imaflex.
Okay, so there is an intimate connection between immune function and inflammation. So the Celebrex, those are drugs that shut down or dampen inflammation in the body. And you can use those medications, but I can also use, with my patients, fish oil. I can use curcumin, or I can use boswellia. All of those will have anti-inflammatory properties as well. I can modify the diet so that people aren't eating inflammatory diets like we discussed earlier. So I kind of like to do the diet, exercise, meditation part before I go straight to the drug, because you'd be surprised how much benefit you can do with these lifestyle choices. And then you don't just get anti-inflammatory benefits, you get a lot of other benefits from making a lifestyle change. So,
do you know any practitioners or facilities for someone to visit to learn about the ketogenic diet?
I went online and looked it up, and there are sites online that will tell you about it. I would recommend that you would find a nutritionist to work with to do this, and you should have the capacity to measure ketones in your urine, and I ideally would like to see you be able to measure your blood sugar as well. So that's an intriguing, potentially very useful diet, but it's tricky. So you have to find a professional team to advise you when you're doing that.
Nice. It's a topic we hear a lot, especially on our online community, so that's helpful.
Right.
Another question is, can you discuss the emerging evidence that medical marijuana is a beneficial CAM approach?
So I do recommend patients to use this. I think it's an incredibly useful drug. I think it's gotten, it's gotten messed up by all the other political, legal, all the other stuff that gets attached around it. The components that you're most interested in when you're thinking about using medical marijuana are THC, tetrahydrocannabinol, or CBD, cannabidiol. THC is the component that's psychoactive, that alters your perceptions, and CBD is the component that's anti-inflammatory, and early data suggests may also be anti-carcinogenic. Medical marijuana can be extremely useful for nausea, for promoting appetite, and again, when I send patients, especially if they have a brain tumor where, we don't want to alter your sensorium, we don't want to alter your thinking, because if we alter your thinking with our medication, then we can't tell when your thinking has changed. Is it because of the medication, or is it because increasing pressure in your head, or something going on with the tumor? So I think this is generally good advice anyway if we use medical marijuana. Look for a type of marijuana that's high in CBD, cannabidiol. You'll get more of the therapeutic effect without as much of the mind-altering effect. If, however, you're using it for sleep, let's say, you may want some THC because that does tend to be more sedative. So there's a ton of research coming out. I was just at a conference yesterday where this exact topic was talked about, and I would really hope that we could find a way to make people have access to legal, well-made, safe medicinal marijuana. So I hope that, and then if you're going to do this, you either need to find a dispensary that's really knowledgeable and can talk to medical patients, or you need to find a physician who knows how to use this material and talk to them.
The same gentleman is also wondering how much CBD can be safely ingested per day.
That's a little bit more difficult. I would say that if you're looking for a therapeutic CBD, because you do develop some tolerance as you use it, so you'll find CBD containing strains that are anywhere from 5% to 12 to 15%. I've even seen ones, but mostly it's between 5 and 12.5% CBD. So I'm a therapeutic conservative therapeutically, so I would always start at the lower dose in terms of the less concentrated, and then I only would use it gradually. Now, I also don't think you need to do this continuously. If you're talking about appetite, you just take a little bit of medical marijuana right before it's time to eat, and that's it. That's what you do every time it's time for you to eat. So, and so basically the dose that's appropriate is a dose that gives you maximum benefit without interfering with your ability to interact with your family, your friends, to do your self-care, to go out and exercise. You don't want to be stoned so that you can't participate in your life. That's not the point. The point is to have your symptoms minimized so that you can participate more in your life.
Great. We have a question about aspartame. Does it have any lasting effects on brain tumors?
This is not something I've done a lot of reading about, but I can tell you that the thing about these artificial sweeteners, I think there were some problems in animal studies with aspartame, but the difficulty is that artificial sweeteners still can activate your glucose button and your insulin button, so they can still bind to insulin receptors and increase insulin release. So even though you don't get the calories, and that's decent, you may still get some of the adverse metabolic effects. So we try to encourage people to decrease their sweet tooth, because we now are all overly, we're used to eating overly sweetened things. And if you're going to sweeten something, you could use a little bit of stevia, or sometimes people call it stevia. And you could use a little bit of honey or agave, but and I think a little bit of sweet is fine, but a lot of is not.
Great. One last question. It's kind of a bunch of them bundled together. It seems like people don't even know where to start. Their doctor doesn't have this conversation with them. So how would a patient or a family member go about finding a practitioner in their area?
Okay, so I think there's a couple of possibilities. I would go to the Society for Integrative Oncology, and I think and find their website online. And if we don't have it completely up yet, we're working on putting rosters up of people who could be that person for you. I would go to the American Holistic Medical Association. That's another place where you might find recommendations for practitioners. I would also get a little bit more creative about querying your community. So let's say you have an acupuncturist you really like, but you want to find out about a physician who might participate with you. Ask your acupuncturist, or ask at the best health food store in your neighborhood, who do they like and who do they send patients to, or who do people like. That's a really, and again, I invite you all to come to the website. We're going to be having a lot of information. Ask some questions there. When we get enough questions in the same vein, I'll write an answer to those questions. And we're thinking about maybe doing a live chat and see if that's going to, like this, but without as many slides, to sort of see if we can answer some questions that way as well. So I'll put it up on the website when we get it organized.
Great. That's all the time we have for today. Thanks for joining us, and thanks again once to Dr. Hardy. We really appreciate you participating in this. Let's pause just for a moment.
To have the opportunity.
Thank you. We'll pause for just a moment to conclude our webinar recording.